Hello, I'm Stephan Weidinger, Professor for Dermatology and Vice Head of the Department of Dermatology and Allergy at the University Hospital Schleswig-Holstein in Kiel, Germany, where I supervise the Center for Inflammatory Skin Diseases. In honor of the 5-year anniversary of the World Atopic Dermatitis Day, which takes place every 14th of September, I would like to discuss the advances in patient care in atopic dermatitis over the last 5 years. While there has been significant progress made in patient care, an increased consideration is now given to the psychodermatology and multidisciplinary care, there is still more to be done. Atopic dermatitis is not only a very common inflammatory skin condition, in fact, it is a very common disease. Other than often thought, it not only affects children, but also a substantial number of adults. Across the world, an estimated 200 million people suffer from AD. AD has a substantial and multidimensional impact on patients' lives. It results in physical discomfort, emotional distress, embarrassment, social stigma, and daily activity limitations. And thereby it profoundly impacts psychosocial well-being and quality of life. Since the World Atopic Dermatitis Day was founded in 2018, we have come a long way. There are innovative, safe and effective treatments available for adults, for teenagers and for children. This is a great achievement in medicine and a revolution in treatment options for patients with atopic dermatitis. Patient care also is gradually shifting away now from treating only certain aspects of disease in isolation to more holistic disease management strategies and towards patient-centered approaches, with patient empowerment and more shared decision-making in consultations. One of the most important factors to consider as a dermatologist when treating people with atopic dermatitis is not only the physical challenges they may face, but also the psychosocial complexities, as well as addressing the gaps in perception about these different obstacles. There are multiple misconceptions about atopic dermatitis. It is still often assumed that AD is a childhood-only, skin-only disease that often outgrows and needs limited treatment only. In fact, AD can be a lifelong condition, affects people of all ages, and requires long-term management. Thanks to studies such as the Atopic Dermatitis Global Adolescent and Pediatric Survey, the AD-GAP study, we now much better understand the full impact of atopic dermatitis, including the enormous social and emotional impacts not only on the patients, but also their families. The AD-GAP survey allowed for us to consider the different experiences and perceptions between physicians, patients, and caregivers, and to uncover gaps in communications. For example, adolescents, and even more so children, live in the here and now and focus on living their lives, with diverse coping mechanisms used to overcome these negative aspects of atopic dermatitis. They often have difficulty understanding or underestimate disease progression. Caregivers, on the other hand, are more future-oriented in their thinking and worry about the long-term consequences of AD and treatments on their child's health. And finally, the survey showed us that healthcare professionals, while acknowledging the discomfort and overall impact of atopic dermatitis, often assess AD from a purely physical standpoint and focus very much on treating signs, but often may not discuss quality of life and the psychological impact with their patients or caregivers on a meaningful level. So when it comes to managing life with AD, different people involved can be on different pages. So what can we do now that we know the results of the AD-GAP survey? As a community, we are committed to addressing gaps in perception and finding solutions to overcome communication gaps. To continue to improve patient care in atopic dermatitis over the next 5 years, the focus needs to be placed on healthcare professionals and their understanding of the importance of holistic assessment and multidisciplinary care, in addition to access to innovative therapies. We can provide individualized care for every patient by engaging in what the patient's individual unmet needs are, as well as understanding the importance of the caregiver role and ensuring they are equipped with the right information to provide assistance. One key step is maximizing the time available during clinic visits, and in particular invest more time upfront at early visits, in order to make patients feeling seen, build trust, and help them understand the chronicity of the disease and its effective management. Structured and coordinated management approaches are a good way to ensure a timely, accurate, and holistic evaluation of the overall clinical situation, which will in turn accelerate access to and optimize care, and will prevent disease progression. Healthcare professionals can also consider psychodermatology techniques and implement them in their practice, or involve psychologists and psychiatrists. Finally, although long-term disease control is the ultimate treatment goal, and with the modern therapies, it can now be achieved in many patients, it is also important to agree on patient-centered short to mid-term goals, which are realistic and achievable. A lot can be done to close the gaps in AD care and to give a true voice to patients, caregivers, and their families. And the World AD Day is an important piece in this context. Thank you for watching.